how to do a physical exam on a canine patient. Things you will need is a pair of gloves, stethoscope, lubricants, your thermometer, and a pen light. Alright, so first thing you want to do is ensure that your patient is on a non-slip surface such as the floor or a mat. Alright, we want to do a nose to tail physical examination. So the first thing we will do is a moderate distance examination. So we're just checking to make sure that there's symmetry in the limbs and the face of the patient. Hello. You want to make sure you greet the patient, alright? And ensure that the patient is comfortable with you touching them. First thing you want to do, check the nose. You want to touch the nose. Check that it's moist and cold. You want to look for any discharges, exudate, anything like that. Then you want to look in the eyes, ensure that there's symmetry. Check for any discharge or discoloration. Then you want to get your pen light and check your PLR. So you want to check for constriction in the pupil. Alright, and then after that, you want to check the mouth. So you want to hold the lips over the teeth. And then you want to pull the mouth open and check inside. And you're looking for any form of ulcerations, discolorations. At the same time, you want to lift the gums and check your capillary refill time by pressing the gums and watching for refill. Alright? Check the dentition of your patient, looking for any periodontal disease or gingivitis. Alright, and then you want to check the ears. And look in the ears for any exudates, alright, or masses. And then you're going to run your hands under the cheek and check for the mandibular lymph nodes. I know. Alright, once you check that, then you palpate the neck, palpate for any masses, and then you want to do your neck flexion test. So you want to flex the neck, nose to tail, laterally on both sides, checking for any pain or discomfort. Then you want to ventriflex the neck and dorsiflex the neck. Alright, once you've done that, then you want to check your prescapular lymph nodes. Alright, and then you want to palpate the forelimbs. Alright, palpating for any pain, heat, swelling. And then when you get to the paws, you're going to check between all the toes. Check the paw pads. Then you want to flex all the joints. Alright, and then you will repeat the same thing on the opposite leg. Once you've done that, then we're going to palpate all the way down the thorax, feeling for any lumps, bumps, anything abnormal. You're also wanting to check the body condition score at this point. Once we've gotten here, then we're going to auscultate the thorax. Going to get your stethoscope. The left side is the best side to hear the heart, right where the elbow meets the chest. That's where you're going to listen. You're going to put your stethoscope, you're going to listen for any, the heartbeat. While you're listening, you also want to palpate the femoral pulse at the same time, and you're checking for synchronicity. Alright, once you've auscultated the heart, you want to move up and auscultate the thorax as well. Alright, while auscultating the heart, it's essential that you count the beats, how many beats you get per minute. Alright, once you've auscultated the heart on the left side, you also want to auscultate on the right side. You auscultate the lungs on the left side, and then you want to auscultate on the right side, checking for any wheezes or crackles. Once you finish with the thorax, then we're going to move on to our abdominal palpation. It's better if your patient is in standing position for this. You want to start with 2 hands right behind the ribs, and you want to palpate from dorsal to ventral, checking for any organomegaly, and we're going to move back while we're palpating. Once we get to the caudal abdomen, then we're going to clasp our hands like this, and we're going to feel the intestine, and they should slide through your fingers like spaghetti, all the way back to the caudal abdomen. Once we finish our palpation, run your hands down the patient. Alright, checking for any lumps, bumps, or anything. Now I want to make sure we check the back of the patient by palpating right along the spine, See if there's any pain or discomfort. Once you get to the back of the patient, we're gonna check the hind limbs for symmetry, all right? And then we're gonna palpate both hind limbs all the way. We're gonna check our toes again like we did in the front, our paws, and then we're gonna flex all our joints. Alright. 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 And then we're gonna check our popliteal lymph nodes. And to lift the tail, we're gonna check the anus, palpate lightly the anal glands, checking for any discoloration, discharges. And then we're gonna check our genitals. So our patient is a male. He has been castrated, so he doesn't have testicles. If he did have testicles, you palpate the testicles to make sure they have symmetry. But then you wanna check the penis. You wanna look at the sheath to see if there's any discharges, mucous membranes, and you can gently pull back the penis just to see if there's any abnormalities on your penis. All right? Once you've done that, now it's time to take our temperature. So we're gonna get a thermometer, place some lubricant on it, and we're gonna stick it in the rectum. Stick it in the rectum, you wanna push the thermometer up against the rectal wall, all right? And then you're gonna take the temperature until your thermometer beeps, all right? And that will be your temperature. Once you've done that, you get a temperature, you will record that. Then you are going to place your gloves on. You're going to put some lubricant on your finger. You're going to, some on the anus, you're gonna stick your index finger into the rectum. You're gonna push up on the lower abdomen, and then you're gonna sweep your finger left to right, palpating the prostate, okay? And that is how you do it.